Hey, welcome back to my channel. Let's talk microneedling. So if you have an appointment coming up, if you're interested in getting this done, let's talk about the pre and post care for this treatment. Okay, so microneedling is going to be a great skin treatment for resurfacing. So fine lines, pores, skin texture, acne scarring, dark spots, collagen stimulation. This is why you're gonna love it. It's going to improve all of that. It is safe for all skin types, all skin tones. Your skin is going to glow, period. So if you have an appointment coming up, I need to make sure you are not laying out in the sun. We don't want you having any suntanner on. We don't want you having any sunburn. That's the main thing. And what I want you to do, don't come in with a face full of makeup. Come in clean skin. We are still going to wash you. We're going to numb you because I don't want you to feel anything during this. But the biggest thing is just don't lay out in the sun. Just before and after. I want you to be mindful. You can be red, swollen, maybe bruised after this. So if you can avoid blood thinners, alcohol, it helps to minimize that. If you can take arnica, that's an herbal supplement. If you can eat pineapple, that helps to minimize bruising and swelling. So do that if you're trying to extra prep and have minimal downtime with this treatment. If you have had any recent waxing, threading, chemical peels, any other skin treatments, I would probably hold off. Make sure that your skin is repaired or let your provider know before you come in and get this done. So if we just finished your treatment, it's going to look a little scary. It could. It varies from everybody. So you can be anywhere from just slightly pink to maybe a little bit more bloody. We are going to wipe that blood off. You're not gonna have to walk out in the streets like that. However, just expect a little bit of rosiness, some swelling. That's normal. You'll still feel a little bit like numb, tingly because that numbing hasn't worn off. Again, normal. What I want you to be mindful of is that we have just made all these controlled wounds on your skin. So these are open pores. I don't want to get any bacteria in them. So hair off the face, hands off the face, hats off the face, no makeup. I don't want you to put anything on the skin besides our post-care serum. This is our recovery boost. This is all you're going to use for the next 48 hours. You're going to keep using it after. This is going to help calm down inflammation, redness. It's antibacterial, antimicrobial, anti-inflammatory. It's going to hydrate the skin. You are going to love it. You're going to want to keep using it every day. Even beyond this, everybody does. And this is like one of our top selling things and everybody always wants to get more of it. So this is going to help calm everything down. That night, you don't need to wash your face because we have thoroughly cleansed you. What I want you to do though is change out your pillowcase. So clean pillowcase, keep the hair off the face. Remember, hands off the face, sleep on your back. If you can sleep a little propped up, that might help with your swelling. You will see over, like when you wake up in the morning, still a little bit swollen, a little bit rosy. That's normal, that's to be expected. I want you to like very much give me at least 24 hours, but it's better if you can give me 48 hours, nothing on the skin besides this. After that, we can go into putting on a light sunscreen, tinted sunscreen, after the 48 hours. I just don't want to be caking on makeup and clogging, these wounds. I don't want to have any infection. So that's what we're trying to avoid. I've never had anybody have any infection, but I'm like a little extra on the post-care. From there, like around day 2, 3, you might notice that your face feels like a little scruffy. That's normal. There are these like tiny micro wounds, micro scabs that are forming. I don't want you to try to scrub them off. You're gonna notice over this next 5 to 7 days post-treatment, they're gonna gently come off when you're in the shower, when you're using your gentle cleanser. You don't need to scrub them off. They're gonna fall off on their own. Usually in the areas where you're more oily, those fall off first, and then like here, it takes a little bit longer. If you do the skin on the neck, your chest, that may take a little longer as well. You're going to be using your sunscreen. You're going to be avoiding the sun. You're not going to lay out. If you're by windows, like put your hat on, just be mindful of sun. Sun on top of this fresh wounded skin, it could make a burn or it could make pigment. So I don't want you to invest in this for nothing. So I would not work out the least first 24 hours. I don't want you getting super sweaty. Remember, I'm trying to think infection control. So let's not work out for 24. If you can give me 48 hours, I'll be even more happy. Remember I was telling you about 5 to 7 days later, you're gonna notice that those flakes are coming off. After about a week, you can use our Microderm scrub. This is going to just give you a little bit extra exfoliation, any little thing that you feel, it's gonna clean all that off. And your skin is just gonna glow. Everyone loves this too. Thanks so much for watching. My team and I cannot wait to see you in here. I cannot wait to see your skin glowing. Let me know questions you have. Text this number to book, like and subscribe, and when you're ready for yours, come see us.